Okay, so this is part 2 lecture video for chapter 9 in your Pharmacy Practice for Technicians book. We are picking up on slide 14. There was a act that was passed in 2005 called the Combat Methamphetamine Epidemic Act of 2005, and it restricts the sales of certain over-the-counter products that contain either pseudoephedrine or ephedrine. And the reason why this was passed is because these items were available over the counter for purchase, no limitations, and the ingredients in those were actually used in the illegal manufacturing of methamphetamine. So if you look on slide 14, it actually gives you a picture of what some of those packages looks like. Many of the cold and sinus medications contain either Sudafed or pseudoephedrine or ephedrine. And now this law, the federal law, restricts the access and sale of these, and in some states have taken it a step further and require a prescription. So part of the restrictions include that these items must be stored behind the counter, not necessarily behind the counter. Most places do, but some places do keep them on the shelf, but in a locked box, so that a staff member has to come unlock it and bring it to the counter to purchase or ring the customer up. They just don't have free access to it, so it cannot be stolen off of the shelf. So the pseudoephedrine quantity is limited to 3.6 grams to be sold to one single individual in a day. And 9 total grams in a 30-day period at one particular location. The purchasers must also be 18 years of older, and they must provide a valid and current photo ID to be able to make that purchase. So in addition, similar to the C5 medications that, like the cough syrups that contain codeine in some states that are sold over the counter, in every state because of the Sudafed and excluding the ones that require a prescription. Arizona does not require a prescription for pseudoephedrine products. So we sell those over the counter. They are kept behind the counter in a locked box. We do have to limit the 3.6 grams per day or the 9 grams per 30-day period at one location to a single individual. And then there is a logbook. So in that logbook, you have to record the street address, the state, the zip code of the customer, the date and time of the purchase, the product being purchased, the amount being purchased, and then the customer signature. Now, some facilities or some retail pharmacies have a very sophisticated pharmacy software that you will just have to swipe the individual's driver's license through or scan it through, and it will take care of that information for you. But for the most part, expect to do a handwritten log. Emergency contraceptives. So this is another thing that we sell over the counter. It used to be available by prescription only, but now it is available over the counter. So things like Plan B, Next Choice, the one dose to be used for individuals that have unprotected sex, or an unprotected intercourse, or in the event that some of the birth control methods that they used didn't work, or the condom broke, whatever the reason, again, is now available over the counter without a prescription for women of all ages. The most important piece to this is if you have an individual that is coming in to purchase Plan B or any of the emergency contraceptives, is they must speak with the pharmacist before you're going to ring them up and let them go. The reason for that is this type of medication is most effective when it's taken in the first 72 hours of unprotected sex. You can take it sooner, but anytime after the 72 hours, typically they run the risk of it's not going to be effective, and then if there is a developing baby, it could be harmful. The way that the emergency contraceptives work is it prevents the implantation of a fertilized egg, and again, we keep those typically behind the counter. Sometimes you'll see them on the shelf, but again, in some sort of locked box. with emergency contraceptives. So there is kind of that fine line with people's morals and beliefs and religious beliefs, and you do have the right to refuse to sell it to an individual if that is against your beliefs, or whatever the case may be. The same thing goes to the pharmacist. However, you must find someone else within the store that will sell it to that individual. So it protects our rights if we don't believe in it, we don't believe in selling it, we don't believe in being a part of that dispensing process, but we also have to accommodate the patient because they have the right to purchase it. So you yourself personally can refuse to be part of that transaction, but you must find someone else within the pharmacy or the store that is going to sell it. Now, the pharmacist has the legal obligation to counsel. So they must counsel the individual who is purchasing that, whether it's male or female, on the indication that it should be taken within the first 72 hours. Anything after that runs the risk of not being effective and potentially causing birth defects. So holistic health medication. So holistic medicine, typically in the quest for health, the whole person should be treated. That's their mantra or their mindset. So mind, body, and spirit. Alternative medicine is limiting treatment to non-conventional therapies, so such as natural products, herbal supplementations, vitamins, acupuncture, yoga. Integrative medicine, holistic practitioners can prescribe a combination of both conventional treatments and alternative medicines together. And that's something that the pharmacist would have to watch for to make sure that there's not going to be any drug and supplement interactions. That's why it's extremely important as a pharmacy technician, when you have an individual that is coming to your counter, whether they are a brand new patient or they're an existing patient, you want to make sure that you're getting as much information from them as possible. So you're asking them, what are they taking over the counter? You want to be able to put these into the patient's profile because that will help the DUR process or the drug utilization review process. So in the event that an individual is prescribed a prescription medication, if they're on a supplement that we have put into that system and there's an interaction, it will flag that. It just goes to ensuring quality care for our patients, but also taking it a step further for patient safety. Some herbal products can have side effects, and most importantly, and most of them can have drug interactions. Homeopathic medication. So homeopathy is based on the theory that like cures like. They're very diluted preparations. They contain only trace elements of the ingredients. It's very popular in Europe. Homeopathic medications are not required to demonstrate safety or efficacy. Some skeptics suggest that homeopathics will offer the placebo effect, but they must follow the standards for good manufacturing practices, meaning that if they say there is a certain amount of whatever the herbal or homeopathic ingredient is, that is actually what is in the container. Dietary supplements, they are also not heavily regulated by the Food and Drug Administration or the FDA. The FDA can step in if these products are making false claims on their labels, such as, this cures a certain ailment. They can't make those false claims. In the event that there is a issue with a particular dietary supplement causing harm to consumers, the FDA will step in and pull it from the shelf. But these dietary supplements, same thing, they're not required to prove safety and efficacy. You want to, if you're using herbal supplementations, you want to make sure that you're purchasing products that have the USP verified seal, which means that company has voluntarily sent off samples of whatever it is and has voluntarily sent that off to labs to be tested for purity, quality, and potency. So it's kind of like a good faith thing that the manufacturer is doing, is saying, hey, you're trusting our products. We're willing to send it off to a company, a lab, to be analyzed and to prove that we say if it's 500 milligrams of vitamin C, that's what you're getting per capsule, tablet, whatever it is. Labels of most dietary supplements will offer limited information compared to over-the-counter products. So you'll see a serving size rather than a dose. So on an over-the-counter item, you will see dose and how to take it. In a dietary supplement, you typically see it referred to as serving size. The label is not allowed to make claims about being a medical cure of any kind. And then you always want to make sure if your patients have questions, and again, it's the same thing. If it's something that you cannot answer from the label itself, you want to always refer your patients to the pharmacist. Most of the time, the questions are going to be that they're taking certain prescription medications, and can they take this supplement on top of or in addition to, and those are going to be clinical questions that the pharmacist is the only one that can answer. Vitamin and minerals, so they have a recommended daily allowance known as RDA, which is the average daily intake level of a vitamin needed to meet daily nutrient requirements for most individuals, healthy individuals. For example, calcium needs vitamin D to help make the bone strong or keep the bone strong and actually convert estrogen, or working to allow the estrogen to convert calcium into bone. Vitamin C is used to boost the immune system, and then we use iron supplementation or iron supplements to help prevent or treat anemia. Herbal and medicinal plants, so they are regulated as dietary supplements and not drugs, okay? So examples of that would be like ginger, echinacea, St. John's wort, ginkgo biloba, and many others. So again, their dosing on the label is listed as serving sizes. And any questions that you may be presented with from patients, you want to refer those over to your pharmacist. Probiotics are available over the counter. They are considered holistic medication. They are not considered an over the counter per se by the FDA. They're considered a dietary supplement. So what it is that it's a product that is used to build up the good microorganisms in the body, particularly in the digestive system. So in our digestive system, we have bacteria that belongs there. The bacteria would be things like Salmonella, E. coli, that type of thing. But within our intestinal tract, it is not causing us an illness. What it's doing is it's helping break down the food and alleviating toxins, and that's what's producing our body to be able to absorb the nutrients we need from the food, and everything else that's waste turns into our bowel movements. Often during the course of prescription antibiotics, it is good to replenish the good bacteria to help prevent against yeast infections that would become opportunistic, and then some of the diarrhea that's associated with the antibiotics. So the problem with the antibiotics is they cannot differentiate between the good bacteria we have in our system that we need versus the bad that's causing the infection somewhere in your body. It wipes it all out. So that's why a lot of doctors will suggest you to take something over the counter that is a probiotic to help replenish that. There's certain yogurts that have live cultures in it. Not all yogurts do, so that's why you would have to look specifically for the yogurts that say live cultures. And then you're looking particularly for two strains, the lactobacillus and the bifidobacterium. Those are the two that will help replenish the good bacteria in your system. So products that you're going to find over the counter would be like Align or Culturelle. Home health and other supplies. So the over-the-counter area is not just for supplements and over-the-counter products. You're looking at things like thermometers, testing kits, test kits for drugs, HIV, even the genetic testings now. Blood pressure monitors. Some places will carry respiratory supplies like nebulizers. Most pharmacies will have diabetic management supplies, so they will have the glucose monitors, they will have the testing strips that go along with it, and then any other durable medical equipment, so things like crutches, shower stands for the elderly, toilet seats for the elderly, those type of things that are used. So your thermometers, again, you can find them in digital, oral, rectal, infrared. Now they're going in the ears. Now you can scan them across the forehead. pregnancy kits, or excuse me, test kits. So pregnancy test kits, ovulation test kits, illegal drug use, HIV, some blood cholesterol, bladder infections. A lot of these different test kits are available over the counter. The important thing is any questions, especially related to the test kits, should be referred to the pharmacist. Blood pressure monitors are used to track blood pressures between doctor visits. So if the patient is having issue with the blood pressure, their cardiologist or their primary care physician may require or recommend that they get a blood pressure cuff and do a log to monitor what their blood pressures are throughout a particular day in a span of time from the first appointment to the next appointment. Respiratory management supplies, so spacers. These are devices to help patients who have difficulty with the coordination in using inhalers effectively, especially pediatric patients and especially elderly. It just allows them to use the inhaler correctly, and it helps get the drug directly into the lungs where it needs to be. Nebulizers are a machine that actually turn asthma medication such as albuterol into a fine mist, and that is used to, the fine mist is then inhaled into the lungs using some sort of mask that is attached to the machine. Diagnosis codes are needed if this is going to be run through insurance for coverage through the patient's insurance company. Other home health supplies, glucometers, insulin syringes, test kits, diabetic supplies. So test strips are actually machine specific for the diabetic testings. The test kits must be matched to the patient's particular glucometer. Syringe sizes, so the higher numbers correspond to skinnier or finer needles. So most of the time you can't just find syringes over the counter. Especially diabetic or hypodermic needles, because those are a lot of time used in illegal drug use. So we keep those typically behind the counter. Insulin pen needles are also purchased separately from the insulin pens themselves. So again, most of the time when a physician is prescribing these, they're going to write a prescription not only for the insulin pen itself, but the needle tips or the pen needles that go on top of it. If they're ordering a vial of insulin for the patient, they probably will be adding on a prescription for insulin syringes as well. Durable medical equipment, again, wheelchairs, hospital beds, canes, orthotics, and most of this would be reimbursable through, for example, Medicare Part B. Now, not every retail facility is going to have wheelchairs. They're not going to have hospital beds, but some individual places would, just depending on the size of the pharmacy and the type of services they're offering. So I want to skip through some of this inventory management piece of it and the accounting and pricing, because we see that in a different sequence. But I do want to touch on drug recalls. So pick up on slide 49. So drug recall. So a manufacturer will alert pharmacies to return a product based on the drug name, the NDC number, the dose, the lot number, and the expiration. So in another video I have posted for you, I go really into detail about that. Drug recalls can be either voluntary through the drug manufacturer or FDA mandated. They are ranked in 3 classes, class 1, 2, and 3, with class 1 being the most severe. All relevant medications, meaning all medications that are included in that drug recall, must be pulled from the shelves. And then contact for patients happens, especially if it's a class 1 or 2 drug recall. So class 1 is urgent or immediate danger, meaning all patients should be who have been dispensed that particular lot should be contacted immediately. 2 is moderate danger, so the pharmacists and physicians must decide the best practice for notifying the patients. And then A class 3 is the least danger, and again, the pharmacists and physicians must decide the best practice for notifying patients. How that's done is done on an individual basis for each facility, but really the main requirement for 1 and 2 classifications is because of the risk of harm, the patients must be notified. And we're going to end there. So stopping on slide 50.